Dr. Frank Simoncini, Southeast Valley Urology, Gilbert, Arizona. I'm the FloFxr. Today's topic, what's the latest and greatest in prostate biopsies? Well, prostate biopsy, the general way this is performed or standard of care is transrectal. With transrectal ultrasound, at least in my office, the downside is it goes through the rectum. So can you have infections? Yes. However, the infection rate is less than 0.4%. How do we get that low? There's a study from Michigan Institute of Urology, and using a certain antimicrobial combination pre-biopsy and a Fleet's enema, we get the infection rate down extremely low, less than 0.4%. That's the standard of care. The latest and greatest is a transperineal biopsy. Transperineal biopsies a little bit more involved as a patient. It goes behind your scrotum above the rectum. So we're going through skin. Technically, the infection rate should be lower. It's a little more complicated. I personally believe we used to do our biopsies that way when we would do, it's called a saturation biopsy. We used to do them that way about 20 years ago. And I really think you get better results that way. The question is it worth doing a transperineal biopsy for a little bit less of an infection rate? I'm not sure it is, but I think one that maybe in some relatively short time frame might become the standard of care if we can find a way to do it in the office efficiently, practically, with less pain and better outcomes than transrectal biopsy, which is the standard of care now. You heard it first from me, Dr. Frank Simoncini, the FloFxr, Southeast Valley Urology, Gilbert, Arizona.